Hello everyone, welcome back to my channel Tarpan Shah. If you are a physiotherapist, physiotherapy student or healthcare professional, today's video will be extremely useful for you. We are diving into some of the most important mnemonics in physiotherapy, simple memory aids that can help you in clinical practice, so stay tuned. Before we start, don't forget to like, share and subscribe for more physiotherapy related content. Let's see the first mnemonic. So we have mnemonics to help us with the acute injury management. The mnemonics is RISE, a classic for treating the acute injury, where R stands for rest, I stands for eye, C stands for compression, E stands for elevation. Rest, ice, compression, elevation. But did you know there's an updated version called PRICE? So PRICE is the modified version which includes P protection, R rest, I ice, C compression, E elevation. So remember to use the price instead of just rise in your practice. Let's see the third mnemonics, that is mnemonics for rehabilitation and strength training. So let's talk about the key principles in rehab and strength training. SAID principle. This explains how our body adapts to the specific demands, where S stands for specific, A stands for adaptation, 2, I stands for imposed and D stands for demand. This means that the training must be specific to the movement and demands of the patient's recovery. Similar mnemonics we have that we call it as a DAPRE, a guide for progressive strength training, where D stands for daily, A stands for adjustable, P stands for progressive, R stands for resistance, E stands for exercise. So use DAPRE to adjust the intensity and progression in strength training. DAPRE, daily, adjustable, progressive, resistance, exercise. Let's see the mnemonics number 4. So the fourth mnemonics is for the predictors of difficult bag marks ventilation. So the mnemonics is MOANS, MOANS. It helps to identify the difficult bag marks ventilation cases, where M stands for marks seal problems, O for obesity, A for aged greater than 55 years, and for no teeth, S stands for stiff lungs. So remember to use this before performing the bag marks ventilation, especially in the critical cases. So DAPRE just now we have seen. The sixth one is mnemonics for pain assessment. In physiotherapy we are assessing the pain, which is very crucial, and the mnemonics is OPQRST. So it is a quick method for the pain assessment, where O stands for onset, P stands for provocating factor, Q stands for quality, R stands for relieving factor, S stands for severity, and T stands for timing. Let's see the seventh mnemonics, that is CLOUD. That means contraindications for mnemonics. CLOUD. C stands for cardiac pacemaker, L stands for low back pain in the bracket pregnancy, O for open wounds, U for unconscious patient, D for DVT, deep vein thrombosis. CLOUD, CLOUD, cardiac pacemaker, low back pain, pregnancy, open wounds, unconscious patient and deep vein thrombosis. Let's see another mnemonics, that is PASS, that is for the proper lifting mechanics. So that is to prevent the injury. So PASS, P stands for plan the lift, how you are going to lift, A for align the body, S means squat with the knees rather than bending from the spine, S stabilize with the core. So use PASS technique to ensure the safe lifting for both patient and even for you as a physical therapist. So that's all for today's video. I hope this mnemonics makes your physiotherapy practice easier and more effective. If you found this video helpful, hit the like button, share it with your fellow physiotherapists, and don't forget to subscribe for more informative content. See you in the next video. Until then, keep learning and keep growing. Thank you.